Assalamu alaikum everyone. Today we are going to discuss about the lobes and blood supply of liver. First of all, we will see the lobes of liver anatomically. So anatomically, liver is divided into four lobes. First one is the right lobe, which is the largest one and lies on the right side. And the second one is the left lobe, lies on the left side, and it is the smaller one, and they are both divided by falciform ligament. Third one is the quadrate lobe. It lies between the inferior vena cava and the ligamentum venosum on the posterior surface. And the fourth one is the quadrate lobe, which lies on the inferior or the visceral surface between gallbladder fossa and the ligamentum teres. Before discussing the functional and segmental lobes of liver, we will briefly talk about the blood supply of liver. So, liver has a dual blood supply. 80% of the blood supply is through the portal vein, while 20% is through the hepatic artery. Portal vein is formed by the union of splenic vein and the superior mesenteric vein. And at the porta hepatis, it divides into right and left portal veins. And if we talk about the hepatic artery, it rises from the celiac trunk and then it divides into left and right hepatic artery. And the venous drainage is through the hepatic veins. There are three hepatic veins, right, left, and middle. They arise in the liver parenchyma and then they drain into the inferior vena cava. If we talk about the segmental division of the liver, there are total 8 segments. 1, 2, 3, 4, 5, 6, 7, and 8. And all the segments have their own portal triad, which consists of portal vein, hepatic artery, and the bile duct. And each one has its own independent blood supply. If we talk about the functional division of the liver, it is divided into right and the left hemiliver. Right has the segment 5, 6, 7, 8, and the left one has 2, 3, and 4 segments, while segment 1 is the caudate lobe of the liver. This is also showing the different segments. Segment 1 is on the posterior side, caudate lobe, and the left hemiliver contains segment 2, 3, 4A, 4B, while the right one contains 4, 5, 6, 7, and 8. These two are on the anterior side, while these two are on the posterior side. These two are on the medial side, and these two are on the lateral side. The functional division is through the cantilized line, which is imaginary line extending from the gallbladder to the inferior vena cava. On the right side, there will be segments 5, 6, 7, 8, and on the left side, there will be segments 2, 3, 4A, and 4B. So the right side, right hemiliver, it is supplied by the right portal vein, right hepatic artery, and drained by the right hepatic vein. While the left hemiliver, it is supplied by the left portal vein, left portal artery, and drained by the left hepatic vein. While the first segment, caudate lobe, it is supplied by the both branches of the portal vein and hepatic vein, and it drains directly into the inferior vena cava. So this is how we divide the liver based on the 3 classifications. Anatomical classification, in which there are 4 lobes, right, left, caudate, and quadrate. On the basis of segmental division, there are 8 segments, and on the basis of function, on the basis of blood supply, there are 2 hemilivers, that is the right and the left hemiliver.